Hi, Stephen.
Test 1 2, test 1 2.
Check. Ladies and gentlemen, this is The Vocal Minority with Nick and Steve.
Nick Reynolds, Steve Harness, and Cousin Brewski. The Vocal Minority with Nick and Steve.
Take one.
That's all we take. We do this in one take, ladies and gentlemen. It's The Vocal Minority with Nick and Steve Brewski. Nothing is pre-planned. It's like a magic trick, but you got to stick around to find out what's so magical about it. Welcome to the show.
I'm going to pull a rabbit out of Brewski. It'll be a fun little trick I do.
Where are you pulling it from, dude?
Well, stay tuned. Ta-da! You don't know where it's coming from. But, yeah, no. Some podcast people like write out their show or plan stuff. Who earns to you? We're professional broadcasters. This is improvisation. We just talk and things come out.
Yes, like rabbits. You can see our webpage, thevocalminority.net. A comment line. That's what we have, 844-48-VOCAL.
Yeah, call up. Use your telephone as a goddamn microphone and use your voice.
What other podcast out there has a telephone number these days? They don't.
We're both old school and progressive at the same time, so yeah. Give the phone line a call, 844-48-VOCAL. Find us on the social medias, the TikTok, the Twitter, the X thing, Reddit, Threads, Facebook, and, of course, YouTube. Always fun on the YouTube. So.
You can find us anywhere worthy of The Vocal Minority with Nick and Steve Brewski, all right? You bastards.
Of course, the actual podcast that the smart ones of you are listening to right now. As I say, it's on any podcast site that it means anything, and that really is true. We're on Spotify, we're on Apple, we're on the Google one. If it posts podcast, we're on it. So you're listening, and I thank you for that. But tell some other people, spread it around, okay?
You know, by the way, I get it off of the iHeart app. You just type in Vocal Minority with Nick and Steve, and boom, it pops right up for you.
Wherever you find your podcast, we're there. Tell somebody.
And let me just be frank, or Harold for a moment. You sound a little aggro today, okay? And I'm just wondering, okay? I'm wondering if you are wound up.
I don't know. I seem fine to me.
You seem angrier, not at me or Brewski or anything, but you just seem angrier today than you do normally.
I'm fine, by which I mean fucked up, insecure, neurotic, and emotional. You know, life's never easy. Just when you think things are going well, somebody's got to throw a curveball at you. So
that's true.
I don't know. I didn't sleep overly well last night. I guess I just woke up on the grumpy side of the bed.
You're entitled, dude. You're entitled to do that, right? I mean, we're all entitled to be a little grumpy now and again. What are we, Clem Fandango? I mean, what are we, perfect? You know? I mean, I don't think so.
Can't possibly be. I love to share everything, but as I always say, like when I share all these things, you don't notice the things I'm not sharing. So those days.
Yeah.
Well, I just want to tell you that if you go to the doctor about this, if it's that serious of an issue, don't hold back. Okay, Stephen?
I've been going to more doctors the past couple of years of my life. I actually have pills in my drawers nowadays. I don't know what that is about. I guess
you take them?
Yeah. I have to get a pill box. I really have started to get to the point where I'm forgetting. Did I take that pill today, or was it the other one? Which fucking pill? Like, I think I have to order a pill box.
You do. I've had a pill box for years, dude.
Yeah.
And you do. I mean, it's the only way. Some of those medications will screw you up if you take more than one, you know. Yeah, you take too much. So, yeah, get a pill box, dude.
Hey, I have a couple of them. I have one for the house, and I have one for the car. The one in the car has Velma on it from Scooby-Doo. So,
nice. Zoinks! Listen, you guys both have like tangible medical issues, though. I'm just falling apart and getting old, you know? I mean, one pill to help with my hair loss, one pill to help with my sanity, one pill to help with my vitality. Like one pill. I'm taking vitamins, I'm taking supplements. I have to take fiber every day now. Like fiber's a new thing. I have fucking Metamucil in my kid.
Are you taking a boner toner, dude?
I've lost track of everything I'm taking. I'm sure one of them.
All right.
Steve's got so many pills on him, he rattles when you shake him.
Exactly.
Well, let me tell you something, dude. The reason I bring up your doctor is because, well, I love my doctor, and I came across an article that I was reading through this list of all these different things you should never mention to your doctor. Okay, there's a lot of people that I'm not, maybe I should step that back. There's not a lot of people, but there's people I know definitely that tell me certain things they say to their doctors, and I'm just like, what the fuck is wrong with you? Why would you ever say that to your doctor? I know people
like I watched the Real Housewives of Orange County, or they're admitting to actual medical issues.
Well, we'll see as I go through my list, but like I know people who have gone in and the doctor will say, we tried this for a while. It's not good for you. I'm going to do something else. And there's a very fine line of you being the customer and the doctor, working for you as a customer service agent. That's a fine line relationship. You can kind of tell your doctor what you would like or what you would like to see, but when you start demanding things from your doctor, I've never seen it go well. I think that's something you sort of got to finesse. Do you just tell your doctor what you want as far as drugs go, as far as treatment goes?
Well, it's funny because every drug ad that you see on TV always says, ask your doctor about Vitaly or whatever the latest thing is. And my thing is always like, I shouldn't be asking my doctor about prescriptions. Shouldn't I tell him what's wrong with me and he tells me what prescriptions are available? Why would I have to ask him?
Or her, right? Or listen.
Which is funny because my doctor's a woman, so I'm sorry that I have that in my head. So.
Because, dude, I think that sometimes, like for instance, I'll give you, for instance, from one of my doctors. They seem to be, I've had this relationship with this doctor for a long time, and they seem to be going and turning a corner to a little bit more of a homeopathic style doctoring, whether it be like, I'm going to give you all these things to try first, these natural things as far as medications go, and then if those don't work, we can explore other options. And that would be when you would have to say, like, I saw that there's something going on that helps with this. Like, well, let's talk about Vitaly or whatever,
Yeah, I don't know. To me, that's like your mechanics. Like, your car's running rough. And I'm like, have you heard of oil? Like, why should I be telling the mechanic? Like, you should be telling me what will fix my ailment, not the other way around.
This is a great example. You've been a part of a doctor-patient relationship, though, where the doctor's been wrong and could have killed you before. So yes. Don't you want to speak up on things that you're doing research on, or at least questioning, isn't there something better for this? Can we look into this? That's what I'm saying. It's a fine line of how you can speak to your doctor.
Yeah, that's a tricky one. I feel any professional I hire, my accountant, my lawyer, like I hired you for these things. I should not be telling my accountant how to add 2 and 2. And doctors, like, some of the things you're referencing, I was misdiagnosed with something that could have killed me. And another doctor, my dad, stepped in and said, you guys got this wrong. You're about to kill my kid. I've heard people throughout my entire life complain about doctors in the medical system. And I've always like, gee, that's not my experience. Yeah, it's because I got a fucking doctor, my father, who shadows me and who makes sure these doctors are doing the right things. And I get that most people don't have that option. And I've been, it's a luxury that I have had. And I've had some bad experiences of late where I'm like, yeah, doctors do kind of fucking suck.
It's a privilege, dude, for sure, because I can tell you when my dad was originally diagnosed with cancer, Dr. Harness looked over his charts to see if there was anything missing, and to have somebody that you can speak to personally that cares about you. It's a huge, huge thing to be able to do.
Yeah, literally saved my life. A few years ago, I was in the emergency room with an acute abdominal pain, and the ER doc diagnosed it as a kidney stone. And he told me, like, I'm going to give you pain pills. It's going to suck the next several days. The pain's going to get worse, but you'll pass the stone and life will be fine. And my dad got on the phone because I always do this thing. Like, my dad wants to talk to you. And doctors always roll their eyes. Like, I don't need to talk to your dad, but I always kind of twist the arm. And my dad talked to this guy and he said, hey, if it's a kidney stone, I want to see it on an MRI or a CAT scan or whatever it is. And the doctor was like, we don't need to run unnecessary tests. And my dad was like, show me the kidney stone or I don't accept what you're saying. So they did the MRI or CAT scan. I don't know. And sure as shit, there was no kidney stone. I had a rare infection called diverticulitis. And if I had let the pain just keep going, my colon would have ruptured. I would have spewed, all of this toxic material into my bloodstream. I would have died from a, blood poisoning, basically.
Yeah.
So doctors can suck. I've had some procedures done in this last 2 years here. I've had 2 different surgeries where at least one of them, the doctor fucking brutalized me. And, I survived it, I guess. But you get put in this situation where you're not the expert on any topic, and this doctor wanted to change the procedure at the last minute. They were supposed to cut something out, and they decided to burn something out, and I just said, okay, you're the doctor, and
right,
thing was skewed and wrong. And
there is a certain amount of trust that we put in our doctors, and being around someone that's in the legal field, I can't tell you guys how many terrible malpractice suits I've heard about over the years. So yeah. Doctors mess up. I'm going to give you some things on a list here that you should never mention to your doctor. The first one they're starting out with is a false medical history. I kind of scoffed when I first read this, but then I thought to myself, like, I could see leaving some things out that maybe you were embarrassed about, or I'll just take me, for instance, so I can tell you the truth about it. Being so overweight, sometimes I'll lie about my weight because I think to myself that it's going to give me a chance to get this in line in the next 3 weeks. You know, like I'm going to get my weight down to that. That's what I told him it was, and that's where I'm going to be. That's false medical history, you know? Yeah. So people do it. Your medical history is always relevant, so you should never lie to your doctor about it, even if you think it's embarrassing. You should always answer any question from your doctor honestly. Withholding vital information about your medical and surgical past could lead to a misdiagnosis, as your doctor doesn't have all the facts. Fair?
Yeah. No, that's fair. Reminds me of an experience I had and of a Key and Peele sketch that probably came out several years ago, but I just stumbled upon it recently on the interwebs. And it's the medical marijuana doctor. The old thing where there's a pot doctor and you have to give him some ailment that will allow them to write a prescription for the pot, but you don't want to say something crazy that's going to trigger red flags, right?
Right. Yeah.
So there's a Key and Peele sketch where, you know, he's at the medical doctor and he's like, you know, so what do you have? Like maybe insomnia, your back hurts? And the guy's like, I have AIDS. And the pot doctor's like, whoa. No. Like that's serious. Like, no, you got to take it down. Maybe your back hurts, right? He's like, oh, I get you. I have cancer. Again, like, no, dude, you're missing my point here. I had a similar experience when I first, back in the day, when medical marijuana was legal in California, but not recreational. I went in there and, you know, the doctor was like, what's your ailment? And I knew there were easy answers, but I tried to give an honest one. I said, I have migraines. Well, okay, pot can help with that, but now I got to see a medical history to show that you have migraines. So do you have like documented evidence of this? And I'm sitting there going, yes, I do. I didn't. So I had to go to my regular doctor, tell her, oh yeah, back in Seattle, I used to have migraines and I put on a prescription. So can you put me on a current prescription? I didn't have fucking migraines. Not that it was any repetitive issue. I do get
right.
But I had to convince my current doctor to write me a prescription for an old thing that I had lied to another doctor about so that I could get medical marijuana from the current guy so he could tell you.
Just go with your back hurts, dude. Right. It's always your back hurts. Come on.
Or insomnia. Yeah. Like, yes. So I went the other way. I gave too elaborate of a medical history and it triggered red flags. So.
I have AIDS. That's hysterical. Hey, dude, the next one that's on this list is that you've diagnosed yourself. Now, this has become a big problem with WebMD and everything else. So much as though that, to throw the term around hypochondriac is not something that I want to do loosely, but I'm going to. There's a lot of hypochondriacs out there that anytime they get sick, they get scared, right? That's just how we are as people.
They go to WebMD and then they're sure that they're about to die.
100%. I'll tell you, my wife, dude, she used to WebMD. Anytime she had an ache or something weird going on, she'd go WebMD. And there were times that she came like to me in tears, like, I think I have cancer, or, I think I have this.
Right.
I'm like, I have tried for 3 years now, and we finally made it to tell you, you're not allowed on WebMD. I outlaw it in this house. You can't get on WebMD. Don't go to work for WebMD. Don't get on your phone for WebMD. Stay off WebMD.
You got to use one of those like porn filters you're supposed to do for kids where you block certain websites.
It's an accountability, right?
Yeah. And it is a slippery slope because if you're like, I have headaches or nausea, like those could be symptoms of a zillion things.
For sure. This says, when something seems wrong, Googling your symptoms is natural, but don't attempt to diagnose yourself or tell your doctor, you've done it, I know what's wrong. The conversation warns that self-diagnosis can only lead to anxiety, stress, and dangerous misdiagnoses. So it's best to listen to your doctor. Let them do their job and diagnose you.
Yeah. I keep a rectal thermometer in at all times just so I can self-diagnose. I'm starting to think it might be overkill.
That's bigger than a thermometer, dude. I've seen it poking out at times.
It's remote control too. I don't know if that was an add-on or what it was, but
you do know the difference between a rectal thermometer and an oral thermometer, right?
No.
The taste?
Exactly.
Good one, Harness.
That's how I test mine. Yes. Ooh, this one tastes a little bitter. This must be the rectal one.
The next one on the list, anything unreasonable. Doctors encourage patients to be open with them and ask questions, but don't say anything unreasonable that might impact the trust in communication. Making demands will only harm your relationship with your doctor and could force them to decide not to treat you anymore. I've seen this happen, like I said, with people who, they said, we're going to try something else. And they're like, no, don't take me off that. I want to be on this, or I want to keep doing this, or let's try this. And they made demands, and you're not a patient here any longer.
Wow. That's interesting. And that sort of sounds like what the story I was just telling about my dad. Like if I had told that doctor, I want a second opinion, I want someone else to consult. And he was like, listen, kid, like I know what I'm talking about. I'm not going to be your doctor. I mean, there's some level of pushback that I think most good doctors would tell you they want. And no doctor should ever frown on a second opinion, by the way. That's a red flag.
Totally, dude. It would just make me feel more comfortable. Like I'm 98% sure I think this is what's going on, but I'd love another set of eyes on this,
Well, if I will say though, if you've got a bullet hole in you and you're bleeding profusely, and they say, "Listen, we should really get a look at that. We should really take care of that." If you say, "I want a second opinion," I don't believe you. I'm bleeding, but I think we got a problem there.
That would match up with this. Anything unreasonable. It is a fine line, like I said. Nothing unreasonable, dude. You're not the doctor.
This has to be a common problem with conservatives, right? Like fake news. That's not a bullet hole. I don't believe you. I want a second opinion on that.
The next one on the list is that you just trust medical professionals. Medical anxiety is common, but never speak down to your doctor or say that you don't trust medical professionals. You may have had bad doctors in the past, but painting all doctors with the same brush won't help you. If you feel you can't trust your doctor, you may need to find another one. And that's how they're going to feel. So to say, I don't trust doctors, they're going to be punitive. You don't trust me. Goodbye. Or I'll
rectal thermometers. Yeah. Oh, you don't trust me, huh? I think it's time for a proctal exam.
Yes.
That's a tough one, which again, like I was joking about fake news conservatives, but I guess doctors probably do have to deal with that. People that just don't trust them. So why are you here? But that it's a valid opinion in some levels. I don't trust doctors. And one of the things my dad tries to specialize in, he has a whole website about it, is speaking non-medicalese to patients. Don't talk down to them. Like speak in human, relatable terms.
Yeah.
And having someone say, like, I don't really trust doctors. A good doctor would probably take that and try to diffuse it a little, find out why you don't, and, relate to you in a way, like not just throw you out.
Sure. To say, I understand this can be scary, dude. I understand you really want to, trust who's, and let me just assure you, I've done this, I went to school here and I keep up to date on practices. You're right. Mm-hmm. It's funny, dude. I love my mother to death. I don't think there's anything I don't love about my mother. She is real bad about going to the doctor. She just doesn't go to the doctor unless she absolutely has to. And I've had conversations with her and she says, I think going to the doctor a lot, they want to put you on everything. She has a friend who goes to the doctor all the time. They're always doing surgeries. And she was like, I don't think those surgeries are that necessary. I think she's making herself sick. That's why I don't go to the doctor. I don't know if there's truth to it or not. But
you know what, though? When we say that about other people's ailments and surgeries, my mother used to always say to me when I would question things that she was doing, Jason, you don't live in my body.
It's true. It's 100% right.
Well, in fairness, I used to, Mom, but okay.
I did for a while.
Yeah, but in that moment, I'm not experiencing what she's experiencing, so I really can't be saying, "Oh, it's all in your head," or it can't be that
100%. I agree with you 100%, too.
I mean, that's where second opinions does come in handy, because if you feel your doctor is overdiagnosing you, then go ask somebody else and see if it's, if two people agree, then you should probably do it. Yeah. Otherwise, it's the old, like, my check engine light comes on, so I just put a piece of tape over it, and now there's no problem.
Ignorance is bliss, dude. Everything's fine.
Yeah.
If no one tells me I have cancer, then I don't have cancer. So obviously, it's a slippery slope. And, my mom is going in for some dementia testing because her sister has it. And my mom's just like, I don't want to be tested. I don't want to find out. I'm like, but if we find out early, there can be treatments and, preventative things. Like if you wait too long, then you're really screwed. So
yeah,
wouldn't you rather get ahead of it than just wait for it to be completely obvious you're sick?
I understand the trepidation for sure. I mean, that's all scary shit. So I understand it, but you're right. You got to get in there because there are things people can do to treat you. And if you wait too long, well, now you're really screwed. So
yes. And if you're a 15-year-old and your doctor wants to examine your prostate, he's just getting ahead of the curve.
Yeah. We'll
he's
go
just
with
being
that.
Thorough.
This is Steve that got prostate exams at 15 and then 15 and a half and then 15 and 3/4. Like, they happened once,
one time, please.
I have begged my doctor over the last year because my brother keeps telling me, you've never had your prostate exam done? And I was like, no, I haven't. He was like, you need to have it done, brother. It has to, you're supposed to go by 45. I asked my doctor, should I be having a prostate exam? And she was like, not until 50. They've upped the age. She was
really?
like, if you're nervous, what are you nervous about? I was like, well, my dad had prostate cancer. And, I'm at a higher risk. So she was like,
Google that. They did drop it to 45 recently. It was always, now it is.
I thought it was 40.
I've never had anything in my butt from a doctor.
That you remember. I don't know.
Right. Yeah. I mean, from other people, sure. But.
Well, I had to have my first colonoscopy, and they told me that it's age 45 now. And when they do the colonoscopy, they check your prostate while you're in there.
So it says here, the American Cancer Society recommends that men at average risk of prostate cancer get their first prostate exam at age 50. However, men who are at a higher risk may need to start screening earlier. And I think your dad having prostate cancer would put you at a higher risk.
I agree, dude. So I'll tell you what she did. She was like,
age 45 is what they say if you're at a higher risk.
So she had me poop in the box for colorectal cancer. Okay. And then she checked my PSA levels, which if you have prostate cancer are generally high. And mine were all within where they needed to be. So she was like, we checked all that stuff. If you still want the prostate exam, I mean, I guess we can go for it. And at this point, I feel like I'm begging for it, and it feels a little weird. Like, please put a finger in my booty.
Right? Can I buy you dinner? Would that convince you to do it? Right. See, this is interesting because I had a conversation with my dad when I turned 45, and my doctor told me that I should get my first, colonoscopy done. And I called him. I was like, my doctor's saying 45. I thought it was always 50. And this may sound racist, but this is factual, okay? So my dad, who is a cancer doctor, who is part of all of these American Cancer Societies and all this stuff, he told me, yes, it is true. We have lowered the age to 45. He said, but it's the fault of African-American men that the age went from 50 to 45.
For prostate cancer?
Yeah. For having your first colonoscopy, that the age dropped from 50 to 45 because of black men. And I was like, whoa, that sounds racist. What are you talking about? Is black guys' fault? And he said it's an average thing. He said the rates of colorectal cancer are higher in African-American men. So the number of them out there right now have pulled the average down. So technically, if you're a white guy, 50 is still the age, but 45, because the pool has gotten bigger, the average has been pulled down because more African-American men get colorectal cancer. So he said the official answer now is 45.
I'm going to continue to try and get that finger. and I'm not afraid of it. So
You shouldn't be afraid of it, but I've had it done of late, and it's not comfortable. I'll tell you that much.
is there any way to have a pinky requested? Can I have a pinky?
It's like when you go to the sex shop, you got to pick the toy that's the right size for what
Yes.
you're looking for. So,
Hey, Doc, any chance we can start with a pinky and work up to the index finger? Like, do me a solid.
yeah.
Next one on the list. These are things you don't want to do to your doctor. You should never share with your doctor your political opinions. And this might sound weird to you. Like, how would you get into that conversation? But there's been plenty of times where it could have come up in my doctor's appointments, whether it was when I was first getting the jab, as MAGA calls it.
I was going to say vaccines has become highly political.
Yes. Medical appointments are supposed to be 100% professional, so mentioning your political opinions to your doctor, not a good idea. Not only are they irrelevant and unnecessary, but they could make the doctor feel scrutinized or threatened. Keep the focus and conversation on your health. Can you imagine, dude, if you went in and was like, F you, Brandon, and it was, you were on the wrong side of things. Your doctor was like, screw that, dude. I'm going to bring his meds back.
I'm dropping your blood pressure, motherfucker. What do you think about that?
Right, yes.
You're not voting if you're not alive. So
I'm going to mix up your samples.
now that's a tricky one because obviously any ethical doctor is not going to care what your political opinions are. But it's such a sad commentary that some science, medicine has become very political.
Yeah.
And vaccines and certain drugs for, whatever, cancers and anything has become political. So yeah, I wouldn't mention it, but medicine has become a political topic. And that's just a sad commentary on the right. That we don't trust science anymore. We don't trust doctors. You're not the freaking expert.
Steve, when we were talking about show today, I said, I've done something like this.
Oh boy.
You should never do this to your doctors. Any lies about your diet or lifestyle.
Okay. I've had doctors ask about like marijuana use before, and I've said no, because none of your fucking business.
Well, I've also seen people like, not at this stage in my life, but when I used to drink more alcohol, like a lot more alcohol, when they'd ask me that question, I tapered it back a little bit.
Right.
Well, yeah, I've done it. You drink a lot. What's a lot?
Right. Yeah. And then they get a little deeper in nightly, one a night, two a night, yeah. So people lie about it for sure.
Yeah, I mean, that's tricky. Those kinds of things, yeah. I mean, when you first said don't lie about your medical history, like you didn't want to tell them you're allergic to penicillin or something, like that sounds dumb, obviously. But yeah, lifestyle choices, that's an interesting one because my initial thought is, yeah, it's none of your business. I don't need to be on some list. But I also have a respiratory issue, so I don't know why I'm not breathing very well.
Right.
You may want to get all the facts out there. So, yeah.
If your doctor's telling you that you could use a little more exercise in your life or, and you're lying, I exercise 3 times a week or whatever, this is research by the National Library of Medicine found 1 in 5 people don't disclose unhealthy diets or lack of exercise in consultations. We frequently lie about things that we're ashamed of, even to doctors. However, doctors aren't there to judge you, so not mentioning these things will only negatively impact your communication and health. So true. I see both sides of it, though, and I've been on that side where, I've lied about my lifestyle.
Everyone should remember there is medical confidentiality. It's just like with your therapist. Like there's no point in not being honest because they're not telling anybody. And probably the most comedic example of that, the doctors in the emergency room see a lot is, how did this light bulb end up your ass?
I slept.
Like, I sat on a light bulb. I don't know what happened. Just tell them what you're doing.
Hey, it's funny because when I first moved to Seattle, I was 27. So I'm young. I'm living up on the hill, and there's, lots of young people around and all that sort of thing, And when I went to the doctor was like, are you engaging in any unprotected sex? And I'm just like, no, not at all. Meanwhile, I just like raw dog some chick the night before or something like that,
But you had a gun on you. I thought he meant that. Like I was protected. I had a gun. So,
but asking you stuff like that, no, not at all. I don't engage in that whatsoever. Not at all.
It's our need to impress everybody, I guess, or just keep our dirty secrets dirty. So
yeah.
We got more time here.
Yeah, plenty of time.
any doorknob complaints, all right? Waiting until the end of your consultation to share important information is one of the most detrimental things you can do. This is known as doorknob complaints in the medical world. Only mentioning concerns at the end of your appointment gives your doctors no time to analyze your symptoms with the attention they require. You put your doctor in a bad situation when you have doorknob complaints.
That's interesting. I mean, in a doctor's office, I would think the one last thing would, I mean, what's the doctor saying? Your hand's on the door, so this appointment's over? I don't want to hear it.
Yeah, towards the end. I mean, you can tell when you're wrapping up an appointment. If you've got your prescriptions and it's time to go, like I wouldn't mention it then. Like I know for my appointments when I make them, especially with my general practitioner, I have to put when I make the appointment, just one issue. I have to write down what I want to talk about. And I'm sure I could bring up something that, maybe just happened that morning, but they got to plan their days. Doctors are busy.
Sure. That's interesting. I would, for the most part, if that's a common thing, this doorknob thing, then first of all, how'd you get a doorknob up your ass? That may be another common problem. What?
I slipped.
Right. Fall in the door. It happens. I got hit by the door, like domestic violence. That's how I got the black eye. But anyways, no, my serious point is if this is a common phenomenon, then I would think it would be incumbent on the doctor to inquire. Like I interview a lot of people on the radio, and we've done it here on the show before. I always do the same thing near the end of the interview. I always ask the person I'm talking to, so is there anything we didn't cover? Anything you want to get out there? Anything you want to say? It gives them the chance to be like, oh, yeah, there is one thing, or you didn't cover this one thing. So I would think doctors should be asking near the end of the visit, like, is there anything we didn't cover? Anything else you want to talk about?
You would think that, dude. If there's one thing that I've learned about healthcare in the real world is that you are your only advocate. If I let doctors just control the way I maneuver through the healthcare system, I would be hurting for certain.
No, for sure. And it is common, and it's so annoying that most of your medical care is actually the nurses or the assistants, because the doctor will swoop in and just really look at the chart you did, and then they're off. And that is so annoying. And that's another thing my dad has railed on, the doctors that do that kind of stuff, that really is a shortcoming on their part. But you can't rely on doctors to be forthcoming enough to sit down and take the time and really dig deep, even though they should.
Yeah.
Yeah.
How about this one? These are things you should never do to your doctor. All right.
Put on Barry White as you ask for the prostate exam.
Oh, I'll try it, dude. That's a good idea. Never tell your doctor you need a favor. All right. Okay. Which, I mean, that seems fairly obvious, but doctors are always happy to help, but that doesn't mean they'll let patients take advantage of them. Never ask your doctor to examine a friend or family member without an appointment or fabricate any prescriptions for you, because they're not going to do it, and might distance themselves from you to protect their credibility. Never ask a doctor for a fave.
What does that mean? Like, hey, my cousin's in the lobby. Can you just check him out real quick too? Like, people do something like that?
Yeah, sometimes you bring people with you, like a lot of the time, Rachel might come to my appointment if it's a longer appointment or something like that and be like, hey, can you, she's been having an ear ringing thing, dude. Can you look in her ear for a minute?
No, you can't do that.
No. I mean, I've heard from a lot of doctors that say, like, when they're at a neighborhood block party or something, that people always come up and say, oh, you're a doctor? My elbow hurts. Can you tell me? And it's so common that doctors have been trained literally to tell people that this is not the setting for that. Like, call my office or, go talk to this kind of person. Like, people do that kind of stuff. So doctors, again, really should be proactive enough to see that coming and head it off in the past. Because of course you don't just double it up with somebody.
It's kind of like when you go to the buffet. If you get the buffet and someone else at your table starts to eat off your plate, they'll start to come over and they'll say to another person, you need to also pay for a plate, no sharing sort of thing.
Yeah, right. Ray Romano used to have a good joke. He's got twins. So he always joked that, when my twins were sick, that he would just take one to the doctor, and whatever the prescribed for the one, he would just double it and give it to them.
Yeah, never ask your doctor for a favor, all right? I would never.
To me, that sounds like, hey, can I ask you a favor? I'm moving on Saturday. Can you help me lift a couch?
This is another thing you should never ask doctors for or do to your doctor. Anything exaggerated. Many people worry their health concerns won't be taken seriously, but exaggerating your symptoms is never a good idea, according to the Society of Clinical Psychology. Patients who overreport symptoms cast doubt on their plausibility and are sometimes accused of faking, in the end, the problem. To avoid this, try not to exaggerate when talking to your doctor. On a scale of 1 to 10, what's your pain level? Oh, I'm at an 8, doc. I'm at an 8 when you're actually at a 4. Just don't do it.
Yeah, that's how you end up with a finger up your butt when that's not what you wanted. Complaining about something or like, oh, I better do a rectal exam. Then like, oh, no, I just needed extra meds. That's not, so careful what you wish for. You just might get it.
Yeah. This is, after all, this is your healthcare. Don't exaggerate things, okay?
Mm-hmm.
Next thing on this list is this is things you should never mention to your doctor that you think you know better. You ever done it?
No, it comes back to what I was talking about earlier, that they're the expert. You can voice your concerns, but get a second opinion if you disagree. But it's like the doctors in comment sections. Everyone's a PhD and an MD, and when they're in the comment section, they all know best. But you're not a fucking doctor, so knock it off.
Listen to me now. It ain't easy to disagree with your doctor's opinion, but never tell them you've done your own research and you think you know better. You're welcome to consult other practitioners, but telling your doctor that they're wrong will come across as arrogant, harm your relationship, and lead to a risky self-diagnosis.
Absolutely.
Doctors don't take kindly to it.
And I've heard people say that they don't want to go get a second opinion because they're worried about offending their doctor. And that is garbage. Your doctor, like I said earlier, that's a red flag if your doctor does not want a second opinion involved. So dump that doctor, then go to second and third opinion. But
yeah,
there's no harm in getting a second opinion. Any doctor should feel safe having someone else look over their shoulder.
And even if it's just for the peace of mind that the other doctor thought the exact same thing as your current doctor does. That's the goal, right?
Exactly. Yeah.
You should never say anything rude to your doctor. While doctors try to stay professional, they have feelings too and won't appreciate being spoken to rudely or disrespectfully. They're there to help you, but they'll part ways with patients who make it hard for them to do their jobs and make them feel uncomfortable or threatened. You should never be rude to your doctor. I feel like that goes without being said, right?
Yeah.
It does. But if you ever worked in any sort of retail environment, and I know all three of us have, people are entitled assholes when they're the customer spending the money. So I would imagine a certain percentage of those people do that kind of shit to their doctors, to their lawyers, and I would disown them too if I was the doctor.
I never just my appointment's at 9:30 and I see the doctor at 9:30. A nurse comes in and may get some vitals, and then I sit in a room for sometimes an hour waiting for my doctor of choice. Whenever I do, they come in and they're like, I'm so sorry for the wait. Things are crazy today. I'm sorry. I can imagine saying like, yeah, I've been sitting here for an hour. Let's go. Let's get this on. Like, you think you're going to get good care?
Yeah,
no.
It's complaining to the waiter or whatever, being rude to the waiter. They're going to go spit in your food back there. It's doing you no good.
Yeah, for sure. How about asking for a sick note? Is this something we do? I don't know. Maybe employers say, like, give me a sick note or whatever. Nobody loves going to work every day, but never mention that you're just going to get a sick note. If you genuinely need one, you'll get one. But trying to pressure a doctor into providing an unnecessary sick note won't go down well. In fact, they might take you less seriously in the end.
That's a weird one. First of all, anytime I've ever had any sort of flu, sickness, or whatever, the doctor always asks, do you want a note for your employer? To which I, for the last, umpteen years, I've said, it's me. I'm going to let myself off the hook, so no problem. But that's a pretty common thing, to need a note for your employer, or if you're a student, to need a note for school. I just brought my son to the doctor for back issues he's having from football practice. And before the doctor even brought it up, I said, hey, he needs a note to get out of practice for the next week because teachers, bosses, they'll give you grief for that kind of thing if you don't have a note.
Yeah.
Appropriately so, by the way, because some people just lie and say, like, yeah, I went to the doctor. They told me I've got Ebola. I can't come in today. It's completely reasonable on the employer side, human resources side, to say that's fine, but I just need a note just for the file. So to ask a doctor for that's not weird. But if you're trying to strong arm them because you're not really sick, then obviously that'd be weird.
I don't know, dude. I don't hire people who I need a sick note from. You know what I mean? And I understand that if I'm working at Burger King and like I'm going to need some sick notes or whatever, but like in the long run, would you ever ask anyone for a sick note that you employ?
I wouldn't. But if you're in a corporate world where sick days have to be accounted for and they have HR rules and blah, 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 like a lot do nowadays, they may require it. And some employee handbooks actually say that if you're claiming a sick day, you just need a doctor's note.
I quit, dude. I quit. I quit that job. I don't want a sick note. I haven't had to have a sick note since high school. All right. Yeah.
The privilege you're exerting, Nick. Some people have shitty jobs. They have to have to follow the rules.
I'll talk to my boss. Listen, this is another thing you should never say to your doctor. And we're going to have to read the description of this one because I don't understand. It says never mention anything to your doctor that's overly personal. I feel like between my therapist and my doctor, those are the two people I mention the most personal shit with, right?
What would be overly personal? I mean, that's the whole thing we've been talking about is you got to share the details if you over drink or do draw. Like you got to share these things. So is there an example of what is overly personal?
It's great to trust your doctor, but remember that the relationship is supposed to be professional. Very Well Health writes about how patients want to be able to trust, negotiate with, and share their worries with their doctor. But that this can lead them to overshare. Becoming overly personal will disrupt your personal relationship. There's a lot of the time where things can cross over when you go to the doctor. Like if, they'll ask you, have you been anxious over the last 7 days? Have you had depression over the last 30 days? Stuff like that. And maybe your doctor will add everything going all right at home or work, so like, I would think you got to share all your personal stuff with your doctor. I can't imagine. I mean, you should know what you shouldn't share with your doctor, right?
I mean, listen, some people can't stop talking. You ask them if you sneeze today and they tell you a 50-year history, or they're just babbling, anxiety. Well, yeah, I was down at the county fair and I got to this day. Like that kind of stuff may be overly sharing if you're just word vomiting on the guy. But yeah, it's a weird thing of a topic that would just be too much sharing. Like, I mean, if they're asking about my prostate and I'm like, I enjoy a vibrating toy up there because that might be over the sharing. That's not the question I was asking you, son. But otherwise, yeah, I would err on the side of oversharing as opposed to undersharing.
Yeah. Well, don't tell them anything overly personal is what this says. Maybe that's like, I hate my sister, stuff like that. Like,
yeah. I mean, sometimes it is TMI that has nothing to do with why you're there for the appointment to begin with.
Right. Yeah. Like the politics thing. I don't know why politics would come up. That seems like that's too much information for what we're doing here. But
this is one we've seen a lot in all fields, but don't ever tell your doctor you pay their wages.
Oh my God. Who does that?
There's people.
They're the same assholes that probably tell cops that I pay your pay. You can't pull me over.
You work for me.
Yeah.
Oh, listen, I've told the cop that.
You have? What did you say, Brewski?
How to go over?
They can get pissed off at me all they want, but you have to explain to me why it is that I'm being told I have to leave, and you can't just go and order me around like that.
Yeah, but that's kind of like the chef's going to spit in your food. If you tell the cop, like, hey, I pay your salary, they're going to find a way to bust you.
Well, that's fine, but in that moment, it's people get pissed at you all the time. But if I feel like you're a public servant and you need to explain to me why it is something's happening. If I'm not making an unreasonable request.
So hold on. First of all, you're correct. They are public servants. We do pay through tax, blah, blah, blah. That is correct. But are you saying like you were pulled over and you're under their thumb, or just they're blocking a road and you want to know why they're blocking the road?
No, it was more like we were a demonstration, and they're telling me you have to move right away and that sort of thing. I'm like, well, why? Well, because I said so. That's why. Well, no, I mean, am I causing a problem? I'm not causing any danger or anything like that. And it was more of the because I said so crap.
You're challenging their oath that they made to you, right? I mean, at that point.
It's kind of like, don't say I'm an adult. You're an adult.
Yeah.
If you say to me, you know what, we've got a safety issue going on here, this, that, and the other thing. Okay, that's the explanation. There we go. We're all set. But when you start talking to me like I'm a 5-year-old and you start saying, well, because I said so, that doesn't fly.
Yeah, listen, I mean, that's an unprofessional response for sure. But boy, you're playing with fire, taunting them with the whole I pay your salary.
I don't care. Yeah, do it. Arrest me.
Yeah, well, that may happen. That's the problem, pissing cops off. I always tell my kids, like, when you're pulled over, yes, you can sit there and exert your rights and tell them this, that, and the other thing. You're much better off saying yes sir, no sir. Because they can bend you over at that time. You may go to court and get it thrown out, but at that moment, they could fuck you over hard.
Yeah, it's got to be worth it. This article says that it's arrogant to tell anyone you pay their wages because you pay taxes. You certainly won't create a good relationship with the doctor if you speak to them that way. If you become frustrated during your appointment, it's a good idea to step outside and cool off before you say something disrespectful like that.
It better be the last time you're visiting that doctor because, yeah, you're just pissing them off. So whether it's a cop or a doctor, you should ask yourself before you say that, am I okay with something going up my butt? If I'm okay with that, then go ahead and throw that in their face. But whether it's the cops with the nightstick or throwing you in jail for the night or the doctor, oh, really? Let me give you a prostate exam real quick, just because since you are so confident in this. Like,
I think you still have to consent for prostate exams, don't you?
I mean, ultimately, I suppose, but if you open Pandora's box, then they may say, well, fine, if you're insisting you've got some issue, let me do a full exam of you, Mr. Know-it-all,
Yeah. Next thing on the list of things you shouldn't say to your healthcare professional is that you understand when you don't. Sometimes your doctor will throw lots of information at you during a consultation, and it's okay if you can't keep up. Don't claim you understand everything they've said if you don't, because you won't have all the facts when managing your condition at home. Your doctor will be happy to repeat themselves. Any good doctor will be anyhow.
Yeah, that's a tough one. That's like what I was talking about earlier. A lot of doctors speak mansplain or medicalese to you or talk down to you, and I think it's pretty common to feel embarrassed to have to ask somebody to explain that again or dumb it down for me. I've gotten good at it because I am dumb, and I tell people, talk to me like I'm a second grader, like I'm paying you for the service. So I've told my accountant that several times, like, explain it to me like I'm a second grader, okay? But that's tough. And again, this is the privilege I have because I've gotten used to just saying yes, and then I call my dad. I'm like, this is what he said. Can you explain what that means? But everyone doesn't have that privilege, and I completely acknowledge that. But you should push back and ask for a better explanation for sure. But I understand embarrassment.
I always tell them to dumb it down if I don't get it. This is, you should never tell your doctor that you're fine when you're not. It's okay to not be okay when speaking to your doctor. Don't hide symptoms or pretend to be fine when you're suffering or scared because they won't be able to help you. Doctors want to continue strengthening their relationship with patients, so always tell them how you're really feeling. Don't play tough.
Well, what are you there for if you're not going to explain what you're not feeling good about or whatever?
I remember my dad when he was going through certain cancer treatments that he would say a lot of the time to the doctor, like, I'm all right, doc, I'm all right. Like playing tough when he should have said oh, my pain's at a 9. I'm nauseous every night, I'm all right. I don't know if it was trying to keep a positive attitude on his part or playing tough for his family and didn't want us to hear it, but I think people do it.
Yeah. I mean, these are a lot of good topics. Some of these seem dumb to me, but some of them do seem legitimate, that people are embarrassed or they don't want to ask to have something explained twice. But, you really got to remember this man or woman or neither is there to help you. So you're better off explaining it all. What about the other side of the coin, though? Do doctors have bad experiences with patients where they get annoyed or they don't like things you've done to them or said to them?
Of course, dude. And, we've all talked about on this show, like Dr. Pimple Popper, Dr. Toenail Cutter. Think about the bad experiences that doctors have. This is not all sunshine and roses, driving a Porsche on Sundays. Being a doctor is nasty, dude.
It is true. Brewski made a good point a couple episodes ago about gynecologists, that it's not all playmates you're looking at down there. You're going to see some terrible mud flaps and yeast infection. Being a doctor, you really do see some terribly gross, nasty things that they somehow develop very thick skin for.
The roast beef is spoiled.
Right.
Ooh, can you imagine, dude? Just having to go down there and grin and bear it. That's the other thing. If you're just a guy getting together with a girl and like, let's just use this as an example. Huge meat curtains, stinky meat. You can be like, woof. But a doctor can't do that. He's got to go in and be like, okay, I'm looking at this here. You know,
Absolutely.
you got to remain professional. Well, people say dumb shit to doctors all the time. I've got a list of some of the dumbest shit doctors have heard from patients. This patient insisted that they had followed their instructions not to eat before surgery because they only had an egg McMuffin on the way to the hospital, but didn't get one with sausage. So it was light enough to make the mark. They tell you that for a reason. You can't get your anesthesia and everything else. So yeah, people are stupid about that kind of stuff. They can't keep food out of their gullets.
Well, and you know, you're shooting yourself in the foot. I need to go to get my cholesterol checked. It's just been on my to-do list. And I almost did it the other day just because I was near the lab and I remembered that I'm supposed to fast before it.
Yeah.
And part of me thought, screw it. Who cares if I had food this morning? Problem is it's going to show your cholesterol higher than it actually is if you've eaten.
Right.
So it's not to your advantage to try to scam on something.
Yeah. They got to get the baseline, dude. That's why they're doing it.
Yeah, I had another one, though, I'll tell you real quick, where the doctor told me it was okay to drink orange juice that morning, but nothing else. You can't drink anything else. And so I got to the doctor that morning, it was for one of my surgeries, and they asked me, have you drank anything this morning? I said, well, I had a glass of orange juice like you said I could. And they were like, did the orange juice have pulp in it? And I was like, yeah. They're like, oh, you're not supposed to have. I'm like, you guys didn't tell me that. Why would you tell me?
You got to be specific.
Right. Orange juice, some has pulp, some doesn't. Why wouldn't you fucking point that out? And then the
just
guy was
assuming, dude, if you have a choice that you'll obviously go with pulp free. That's so nasty, dude. You're drinking pulp in 2024?
Dude, pulp is healthy for you. That's fiber. That helps offset some of the pure sugar that's in your orange juice. So you should always be drinking pulp in your orange juice.
Little skin worms, you know, like just drinking a glass of orange juice and letting those skin worms go down.
Do you eat oranges ever?
Listen, they don't have the same consistency as skin worms rolling down your throat.
Please, you're ridiculous. And by the way, that nurse was like, I think it's okay. Well, then what's the rule?
I've always been told you can have just black coffee, nothing in it. If it's just black coffee, you're fine. Doesn't make sense to me.
That sounds racist.
This guy, right? Not everything's about race, Steve.
You said it was black coffee. So,
this guy comes into the ER with an abdominal pain. All right. While working him up, we're getting some history. Just released from prison a few days ago. Living in mom's house with mold growing openly on walls and ceilings. Walking through the kitchen, spotted some amber liquid in a plastic cup on top of the fridge, tossed it back, swallowed it. It was Pine Sol. CT comes back, has interoception of small intestine. While waiting for surgery consult, I'm looking at his foot. Small amount of blood on his sock. Hole noted in sock, Remove sock. Fine gunshot wound. Oh, yeah. I was walking around twirling a gun and shot myself in the foot as well. All nonchalant. Why wouldn't you tell everybody? I mean, this guy's obviously mentally ill, right?
Well, I was going to say, he's drinking poison. He's shooting himself in the foot, literally and figuratively. So that's pretty hilarious, though. Like, that's that doorknob thing you were talking about. Like, oh, yeah, hey, by the way, I also have a gun wound.
Yeah.
I don't know if is that relevant?
Yeah. Mean anything? I don't know.
Yeah, wow.
Here's a dialysis patient on fluid restriction, came in with severe volume overload. When asked how much water he drinks, he insists he's only drinking 8 ounces a day. The nurse pressed him a little more, and he admitted to drinking a gallon of milk a day, exceeding his 64 ounce of fluids a day. He didn't realize milk counted as fluid.
This is like dumb criminal kind of stuff.
Dumb criminal.
Dumb patients.
My patient who crawled under his truck and leg pressed his engine back into place 2 weeks after his total hip arthroplasty came into the clinic complaining of pain.
That's a dude that wants to get the job done. That's
When's the last time you got under an engine and just leg pressed it real quick?
I mean, no matter how healthy you are, that's got to be a bad thing to be doing. So, yeah.
Medical social worker here. I had a patient who discovered a full prescription that someone dropped in a Walmart parking lot. As he enjoyed taking drugs, he swallowed an entire bottle of blood pressure medication and wound up passing out in the middle of crossing the street, almost got crushed to death. I talked to him about how maybe that wasn't the brightest idea. He said he just wondered what they would do, and I could tell that he'd do it again if he had the chance. He probably went right back to the Walmart hoping to score again.
Wow. As just general medical advice, and I'm not a doctor, taking an entire bottle of anything is usually not going to end well for you.
NyQuil, dude, or Robitussin. I mean, all those things are fun, but I'm not a doctor either.
Listen, I've been in a concert or two where I'm like, what is that? I just give it to me. That's fine. But I've never taken a handful of something or a bottle of something. But I've known people that find random pills and are like, let me pop it, see what this thing does, which seems stupid, but an entire bottle.
No, so I was actually once on a bus. There's some dude that got on the bus, and he looked on the floor. There was this pill, and the guy picked it up, looked at it, blew on it, and like popped it in his mouth and swallowed it like nothing. He's like, okay, let's see what happens. Jeez. And I'm thinking, wow, that's pill roulette. That's
no anxiety. Come on.
Right. What are the odds that pill is something good, something fun and psychedelic? Like, boy, that really is pill roulette. You're right.
Yeah, exactly.
I remember just back in the day, we talk about like all drugs being laced so much easier nowadays. But I remember being at concerts, and one particular concert, this old guy was smoking a bowl out of a pipe that you made with a bunch of metal fittings, old school style. Yeah. He said, he looked at me and he kind of lowered his head and he said, "You want some?" And we had smoked everything we had. I said, "Sure. Is it pot?" And he was like, "Yep. But this stuff will knock your dick in the dirt." And I was like, "Sure it will, old man. Give me some of that." And I'm pretty sure it was laced with something, because it did indeed knock my dick in the dirt. And I won't ever, if I don't trust you, I'm not taking anything from strangers nowadays.
That's bad etiquette on his part, because, if you're offering stuff to strangers, you got to know that it's neutral. I mean, I've been at concerts where I hand the joint to someone next to me because they seem hip and cool, but to give it to them when it's laced, like, man, what if there's an allergic reaction or
sure, heart issue?
Yeah, heart issue.
Hey, listen, I had a friend, someone that I grew up with, just smoking a bowl. He hands it to me. I'm like, okay, why not? So I'm smoking a little bit. All of a sudden, my throat starts getting all mentholy. And I'm just like, what the hell? And that sort of thing. It basically told me that it was laced with Coke.
Yeah.
Oh, wow.
And I was just saying, and let's just say that it then escalated into fisticuffs between him and I, because again, if I'm trusting you, don't put me in that position.
Especially you with a heart condition.
You should blame him for your heart condition. All right. My brother poked me with, we were in a zoo one time in a biodome, and he took a needle off a rare African cactus, and he put it about 3 inches into my body. It was a needle sharp. And I always tell him, like, you gave me MS, dude. That's there was something on that thing, and I make him feel guilty about it. You should tell that guy he gave you a heart issue.
Did Hondo do that to you?
Yes, dude. That guy has done so much shit to me. I was sitting at a restaurant one time. We were getting ready for Bananas Foster, and they came out and made the Bananas Foster. For those of you who don't know, they prepare it at the table, and there's a little, a
flambe.
Yeah, and they put a burner, and they prepare it at the table. This guy left the burner there. Hondo takes a spoon and roasts it on that burner for, I don't know, he got it red hot, and then he pressed it into my skin on my arm. Thought it was the funniest shit he'd ever seen.
Branded you.
And branded me.
Wow. Oh, God. That is such a brother thing. I mean,
yeah.
Tell him all the time, you gave me MS, dude. Can I borrow $20? This person says, I worked in physical rehab hospital and would witness this conversation between the doctor and a newly admitted patient. "Do you know what caused your stroke?" "Well, the hospital told me it was because I have high blood pressure, but I don't anymore. The high blood pressure medication cured it, so I stopped taking it. Didn't your primary care tell you that you had to keep taking that medication? Yeah, but you know how doctors are. They get kickbacks from the drug companies for keeping us on all this shit we don't need. Well, I got news for you. High blood pressure caused your stroke. So, people are dumb about their health care. That's the moral of this story. It's people that are doing, conspiracy theory shit that seem to be real dumb. It seems to lead people to WebMD. You're real dumb when you have a little information. So just trust your doctor.
Yeah. And listen, there is some truth to that fact that doctors do get some sort of bonuses or perks when they prescribe certain medications, but that tends to be like diet pills and stuff, hair loss pills, like not blood pressure pills or cancer medications, things like that. And you got to be smart enough to know any medication you're on, at a minimum, you got to wean off of that stuff. You can make yourself super sick.
Yeah. Yeah. Oh, yeah. You can have all kinds of, health issues if you take antidepressants, whatever you might be taking. You got to taper off.
Yeah. And it's another classic mistake, by the way, where you do get put on like antibiotics, for example, and they give you a week's worth and 2 days later you feel better. So you stop taking the rest of it. And it's dumb. It's going to come back on you or, it's going to back. So,
they always tell you take it until it's gone, dude.
Yeah, exactly. Or sell it at the schoolyard. One of the two.
I was going to tell you guys regarding strokes.
Yeah.
So these 3 old ladies are sitting on a park bench. This flasher walks up to them and he opens his coat. And he opens to the first lady. He opens his coat, flashes her, and she goes, oh, and has a stroke. He goes to the second lady. He opens his coat. She says, oh, and has a stroke. He goes to the third lady, opens his coat. She goes, oh, but she didn't have a stroke. Because her arms were too short to reach.
The old short arm joke. Yes. Stroke me, stroke me. Well, I think that'll do it, ladies and gentlemen. The Vocal Minority with Nick and Steve, all of Brewski, always here for a stroke.
Yes. I used to watch a medical show. It was called Different Strokes. It was describing different ailments. I think that was what it was about.
That was a porno that you used to watch, dude. That wasn't Arnold. What you talking about, Willis?
I see. Sorry. All right, yeah. Find us on the interweb, thevocalminority.net. Please share all of our social medias and follow us on your podcast sites. You can do it. Just click the subscribe button. No harm will come to you, I promise.
Those great things. We'll continue to bring great programming. Call us on our comment line. Tell us how we can do that for you. 844-48-VOCAL. After all, we do work for you. You pay our salaries, for crying out loud.
That's kind of true. So, yes. And I may spit in your food and in your mouth if you ask nicely.
Oh, that's nice. Brewski, please, if you will.
Stroke you later.
And we say bye-bye.
Test 1 2, test 1 2.
Stop.
This is Clem Fandango. Can you hear me?
Yeah, I can hear you, Clem Fandango.